Assessment of a 16-year-old null aggravate client who visits the clinic and asks for information on contraceptives reveals a menstrual cycle of 28 days. The nurse formulates a nursing diagnosis of deficient knowledge related to ovulation and fertility management. Which of the following would be important to include in the teaching plan for the client? 1. The ovum survives for 96 hours after ovulation, making conception possible during this time. 2. The basal body temperature falls at least O to F after ovulation has occurred. 3. Ovulation usually occurs on day 14, plus or minus 2 days, before the onset of the next menstrual cycle. 4. Most women can tell they have ovulated because of severe pain and thick, scant cervical mucus. Answer and rationale. 3 is the correct answer. For a client with a menstrual cycle of 28 days, ovulation usually occurs on day 14, plus or minus 2 days, before the onset of the next menstrual cycle. Stated another way, the menstrual period begins about 2 weeks after ovulation has occurred. Ovulation does not usually occur during the menses component of the cycle when the uterine lining is being shed. In most women, the ovum survives for about 12 to 24 hours after ovulation, during which time conception is possible. The basal body temperature rises O5 to 1 OF when ovulation occurs. Although some women experience some pelvic discomfort during ovulation, Mittelschmerz, severe or unusual pain is rare. After ovulation, the cervical mucus is thin and copious. Which of the following instructions about activities during menstruation would the nurse include when counseling an adolescent who has just begun to menstruate? 1. Take a mild analgesic if needed for menstrual pain. 2. Avoid cold foods if menstrual pain persists. 3. Stop exercise while menstruating. 4. Avoid sexual intercourse while menstruating. Answer and rationale. 1 is the correct answer. The nurse should instruct the client to take a mild analgesic, such as ibuprofen, if menstrual pain or cramps are present. The client should also eat foods rich in iron and should continue moderate exercise during menstruation, which increases abdominal tone. Avoiding cold foods will not decrease dysmenorrhea. Sexual intercourse is not prohibited during menstruation, but the male partner should wear a condom to prevent exposure to blood. After conducting a class for female adolescents about human reproduction, which of the following statements indicates that the school nurse's teaching has been effective? 1. Under ideal conditions, sperm can reach the ovum in 15 to 30 minutes, resulting in pregnancy. 2. I won't become pregnant if I abstain from intercourse during the last 14 days of my menstrual cycle. 3. Sperm from a healthy male usually remain viable in the female reproductive tract for 96 hours. 4. After an ovum is fertilized by a sperm, the ovum then contains 21 pairs of chromosomes. Answer and rationale. 1 is the correct answer. Under ideal conditions, sperm can reach ovum in 15 to 30 minutes. This is an important point to make with adolescents who may be sexually active. Many people believe that the time interval is much longer and that they can wait until after intercourse to take steps to prevent conception. Without protection, pregnancy and sexually transmitted diseases can occur. When using the abstinence or calendar method, the couple should abstain from intercourse on the days of the menstrual cycle when the woman is most likely to conceive. Using a 28-day cycle as an example, a couple should abstain from coitus 3 to 4 days before ovulation days 10 through 14 and 3 to 4 days after ovulation days 15 through 18. Sperm from a healthy male can remain viable for 24 to 72 hours in the female reproductive tract. If the female client ovulates after coitus, there is a possibility that fertilization can occur. Before fertilization, the ovum and sperm each contain 23 chromosomes. After fertilization, the conceptus contains 46 chromosomes unless there is a chromosomal abnormality. A 20-year-old null aggravate client expresses a desire to learn more about the symptothermal method of family planning. Which of the following would the nurse include in the teaching plan? 1. This method has a 50% failure rate during the first year of use. 2. Couples must abstain from coitus for 5 days after the menses. 3. Cervical mucus is carefully monitored for changes. 4. The male partner uses condoms for significant effectiveness. Answer and rationale. 3 is the correct answer. The symptothermal method is a natural method of fertility management that depends on knowing when ovulation has occurred. Because regular menstrual cycles can vary by 1 to 2 days in either direction, the symptothermal method requires daily basal body temperature assessments plus close monitoring of cervical mucus changes. The method relies on abstinence during the period of ovulation, which occurs approximately 14 days before the beginning of the next cycle. Abstinence from coitus for 5 days after menses is unnecessary because it is unlikely that ovulation will occur during this time period days 1 through 10. Typically, the failure rate for this method is between 10% and 20%. Although a condom may increase the effectiveness of this method, most clients who choose natural methods are not interested in chemical or barrier types of FAML. Before advising a 24-year-old client desiring oral contraceptives for family planning, the nurse would assess the client for signs and symptoms of which of the following: 1. Anemia. 2. Hypertension. 3. Dysmenorrhea. 4. Acne vulgaris. Answer and rationale. 2 is the correct answer. Before advising a client about oral contraceptives, the nurse needs to assess the client for signs and symptoms of hypertension. Clients who have hypertension, thrombophlebitis, obesity, or a family history of cerebral or cardiovascular accident are poor candidates for oral contraceptives. In addition, women who smoke, are older than 40 years of age, or have a history of pulmonary disease should be advised to use a different method. Iron deficiency anemia, dysmenorrhea, and acne are not contraindications for the use of oral contraceptives. Iron deficiency anemia is a common disorder in young women. Oral contraceptives decrease the amount of menstrual flow and thus decrease the amount of iron lost through menses, thereby providing a beneficial effect when used by clients with anemia. Low-dose oral contraceptives to prevent ovulation may be effective in decreasing the severity of dysmenorrhea, painful menstruation. Dysmenorrhea is thought to be caused by the release of prostaglandins in response to tissue destruction during the ischemic phase of the menstrual cycle. Use of oral contraceptives commonly improves facial acne. After instructing a 20-year-old null-gravid client about adverse effects of oral contraceptives, the nurse determines that further instruction is needed when the client states which of the following as an adverse effect: 1. Weight gain. 2. Nausea. 3. Headache. 4. Ovarian cancer. Answer and rationale. 4 is the correct answer. The nurse determines that the client needs further instruction when the client says that one of the adverse effects of oral contraceptive use is ovarian cancer. Some studies suggest that ovarian and endometrial cancer are reduced in women using oral contraceptives. Other adverse effects of oral contraceptives include weight gain, nausea, headache, breakthrough bleeding, and manilial infections. The most serious adverse effect is thrombophlebitis. A 22-year-old null-gravid client tells the nurse that she and her husband have been considering using condoms for family planning. Which of the following instructions should the nurse include about the use of condoms as a method for family planning? 1. Using a spermicide with the condom offers added protection against pregnancy. 2. Natural skin condoms protect against sexually transmitted diseases. 3. The typical failure rate for couples using condoms is about 25. 4. Condom users commonly report pineal gland sensitivity. Answer and rationale. 1 is the correct answer. The typical failure rate of a condom is approximately 12% to 14%. Adding a spermicide can decrease this potential failure rate because it offers additional protection against pregnancy. Natural skin condoms do not offer the same protection against sexually transmitted diseases caused by viruses as latex condoms do. Unlike latex condoms, natural skin membrane condoms do not prevent the passage of viruses. Most condom users report decreased pineal gland sensitivity. However, some users do report an increased sensitivity or allergic reaction, such as a rash to latex, necessitating the use of another method of family planning or a switch to a natural skin condom. Which of the following would the nurse include in the teaching plan for a 32-year-old female client requesting information about using a diaphragm for family planning? 1. Douching with an acidic solution after intercourse is recommended. 2. Diaphragms should not be used if the client develops acute cervicitis. 3. The diaphragm should be washed in a weak solution of bleach and water. 4. The diaphragm should be left in place for 2 hours after intercourse. Answer and rationale. 2 is the correct answer. The teaching plan should include a caution that a diaphragm should not be used if the client develops acute cervicitis, possibly aggravated by contact with the rubber of the diaphragm. Some studies have also associated diaphragm use with increased incidence of urinary tract infections. Douching after use of a diaphragm and intercourse is not recommended because pregnancy could occur. The diaphragm should be inspected and washed with mild soap and water after each use. A diaphragm should be left in place for at least 6 hours, but no longer than 24 hours after intercourse. More spermicidal jelly or cream should be used if intercourse is repeated during this period.